This is Alexi Boyd with AI Med Talks. We're talking to Amit Shetty from the Westmead Medical Research Unit, and he's just come off stage delivering what was a really fantastic presentation. Amit, tell us a little bit about what you were educating the audience on.
I was sharing our experience of putting in an intelligent algorithm into our systems, which helps our clinicians in the front line detect sepsis in the emergency departments. We developed this tool in house. It's been a decade long work of capturing what we've done over paper systems, translating it into EMR systems, and then going into an intelligent space of actually using EMR existing data to tell us who are the patients who are at high risk of sepsis.
That sounds so interesting. Is it something that can be transferred to other hospitals, or is it quite unique to the system that you've got in yours?
No, the learning system was based on using the CEC's, which is Clinical Excellence Commission's sepsis skills pathway. And that's a standard pathway across the state. It uses standard data elements from our EMR systems, such as age, vital signs, presenting problems, which are common across the state. So, in fact, after a year of application and validation data, I also worked with the CEC and the sepsis skills pathway for the state. So we are going to be putting this algorithm across the state with the next evolution, which is probably in 2020, early 2020.
And the AI Med conference obviously brings together clinicians from lots of different aspects of healthcare, as well as people from all over the world. Is this something that you're finding in the networking part of AI Med conference? People are quite interested in how you've developed this pathway and how you've implemented it? Has it been an important part of your conversations?
Yes, it has, because I think a lot of times what we find is a lot of skepticism about the use of AI in healthcare, about a lot around the barriers to actually putting in systems in healthcare around use of AI, or just digital healthcare. I wanted to present a more positive outlook on that, and I think apart from sepsis, we're doing a lot of work in this space at New South Wales Health. It just helps to know that, and to put it out there that it is hard, but I think most change in healthcare is hard. If you are going to put in certain systems which are going to impact patient outcomes or interventions in patients, you have to be realistic and know that it's going to take long to put the system in, validate it, and then put in. Just for example, the alert going off and not going off means the patient may or may not get a certain set of interventions. So I think it is very important that we do this slowly and do it right, because if we get it wrong, the risk for patient outcomes is real.
And that's a really important message that you've got there, is that it is a long process to implement this sort of AI. It's not something that can happen overnight. Is there an expectation out there that because technology is getting faster, that it means we can have these sort of advancements sooner, or do we have to be quite realistic?
Look, I think it's about getting the first stage in. And once we've done sepsis, I think the next stage, if we do, let's say, chest pain, it won't take as long, because we've created runs on the board, we've got trust with the clinicians. And as long as we are true to the principles of co-designing it with the clinicians, using validated algorithms, and actually having learning systems where you implement them and show the clinicians the performance characteristics. Nothing worse than putting an alert in and never evaluating how it functions, because you would be surprised. The frontline clinicians pick up straight away if something is worthwhile or not.
Yeah, and it'll be disregarded pretty quickly, I imagine.
Yes.
And what else have you benefited from being here at AI Med? What other talks have you heard that you found quite fascinating?
Look, I mean, Anthony Chang, was it? Yeah, it was inspirational, because I think, and it's interesting to learn that internationally all of us have the same struggles or even the same barriers, but in most of them, the positive outlook is that we are moving ahead. And I think, again, in most spaces, the principles are the same, which is it doesn't matter if it is AI or any other technology. I think any technology for improvement. It took us 200 years to put hand washing into healthcare, so hopefully this won't take that long. But yeah, it will get there.
Hopefully it'll be faster than the hand washing.
Yeah.
It's fantastic. Well, thank you so much for coming along and talking to AI Med Talks. You've been talking to Alexi Boyd and Dr. Amit Shetty. How can people find out about your work and the advancements that you've made?
You can just connect with me on LinkedIn if you want to personally have a chat with me. Otherwise, hopefully next year you'll have the pathway on available across the state in New South Wales Health, and you just have to look up CEC sepsis skills algorithm, which will come up on there.
Fantastic. Well, thank you so much for sharing your journey and all that fantastic information, and for presenting today at AI Med Conference.